Hi, my name is Erica Sutton and my student ID is 3648426. This video is for the fall 2025 semester for the veterinary nursing class. Thank you.
All right, so in this video, I'll be demonstrating how to do an ear cleaning on a canine patient. So I have my materials here. I have some ear cleaner, I have gauze, and then I also have some cotton tipped applicators. So first, what I want to do is you're going to open up your ear cleaner, and then you open up the ear as well. So the canine ear, it goes down and then it kind of goes in too. It's like an L shaped. So it's kind of hard to get down in there. But what I do is you kind of open up the ear, and then you don't want to touch the end of the bottle to the ear because you don't want to get that dirty. So I'm going to move some of her hair out of the way, and then you just pour some of the solution into her ear, and then I pull the ear up to try to get some of that down there, and then just squeeze at the base of the ear to kind of mush it together and get everything apart down there. All right, so once that's in there good, I get some gauze, and then I just put it around my finger and stick that in there and kind of clean out the inner ear. And then kind of get into the little crevices as well that are on the ear where the debris likes to hide. Her ears aren't too bad. I'll do one more to dry it out a little bit. Do however many it takes to get the ear clean. Some dogs' ears are pretty dirty, so it might take a lot of gauze to get them clean. But that looks pretty good. And then I also just get a Q-tip so that I can get some of the crevices that are on the outside of the ear. I don't really stick the Q-tip into the ear because you can cause trauma to the eardrum. But hers look pretty good. All right, and then if you were to have to medicate the ear, you would wait 20 minutes in between cleaning them and medicating. So we'll wait and then we'll come back. So now that it's been 20 minutes from the time that we did the ear cleaning to now, we can then medicate the ear. So I have the medication right here. So what you want to do is kind of similar to the ear cleaning, but since they're going home with this, you can put it in the ear. So this medication can go right into the ear, and you just give one good squeeze, and then you want to mush it into the ear as well, and then you just leave it. You don't clean anything out after that. All right, thank you. In this video, I'll be demonstrating how to do an ear cleaning on a feline patient. This one is sedated right now. We currently have her on a monitor. She's on her SpO2, and she's breathing well. So first, I have all my supplies. So I have our ear cleaner, I have gauze, and then I also have some cotton tipped applicators as well. So the ear is just like the dog in anatomy, where it goes kind of down into the inside. So it's kind of like an L. So you really want to make sure you kind of try to get it down there and swish around what's in there. So first I'll start by applying some of the ear cleaner. So I kind of pick up the ear, and you want to pour the cleaner into there without touching the ear. So you just put a little bit in there, and then I lift up the ears to get it down in there, and then I kind of squeeze at the base of the ear to get it mixed up all around and break up the debris. Okay, so once I have that, I will get some gauze, and I like to clean it out with some gauze first. And then I'll actually put a little bit of the ear cleaner on some gauze too, just to, so it's not dry. And then since cat ears are pretty small, I tend to use some more cotton tipped applicators on them than you do for canines. So I got pretty much the external part of the ear all clean. And now I just grab a cotton tipped applicator or two and just get in the grooves of the ear that I can see where some of the debris gets stuck, and clean those out. And then I will do one a little farther down. And these actually look pretty good, so I'll do one more. Oh, sometimes it kind of hides in the crevices, so I'll do one more. Okay, so now that I'm not getting back any more debris, it's up Good, and we'll wait 20 minutes before we medicate with the actual ear medication. All right, so now that it's been 20 minutes, I can now medicate the ear. So I have my medication here, and what I'm gonna do is I'm gonna squeeze, just a good squeeze into the ear, and then mix it around like we did the ear medication. So you kind of put it in here, I'm gonna put it down, squeeze the medication in, and then kind of get the base of the ear and make sure you squeeze that in there. And then we're just gonna leave that. Thank you. In this video, I'll be demonstrating how to use a rabies pole on a patient. So right here I have my rabies pole. So it's loose right now. In order to tighten it, you just pull the end and it'll tighten it up. So what I want to do is, this is used on dogs that may have rabies or that are aggressive. So what I'm going to do is I'm going to open the kennel. I'm not going to let him out. I'm going to put the rabies pole around his head first and tighten it a little bit, and then I can let him out and stay behind him and from a distance so that he's not near me. So I'm going to open the kennel. I'm going to put this in here first. I'm going to put it around him. And then you want to put it high up on the base of the skull and tighten it a little bit. And then I can lead him out of there with this and keep him at a distance. So it's high up on his neck. It's not too loose so that it doesn't cut off any breathing, and it's not too tight, and then it's not too loose so you can get out of it. So I have control of him now, and I can move him wherever I need to. In this video, I'll be demonstrating how to apply a modified Robert Jones bandage with a splint. So I have all my materials over here. I have tape, I have my stretch gauze, my cast padding, and my vet wrap, and then also the elasticon. So what I'll do, we're going to be applying the bandage to her front leg. So I'm going to start by applying the tape, which is going to be for stirrups on her leg. So I'll apply the tape and drag it out a little past the paw. And then I do have a popsicle stick to stick it on so that it doesn't stick to anything else. And then I'll get another piece of tape and put it on the other side of her. Again, pull it a little past her paw. And then I can use the popsicle stick to kind of stick them both together. So that's going to stay like that for a little while. Okay, and then I'm going to start with my cast padding. So I'll grab my cast padding, and what you're going to do is I'll start at the bottom, and you want to leave a little bit of the toes left. So I'm just going to go right above the toes, and then I can start wrapping it around. And whenever I go up, you want to cover at least half of the previous layer that you did. So you want to go half each time you go up. So I'll just keep doing that. And we're going to apply about 3 to 4 layers of this. And you want to make sure that there's no wrinkles in this cast padding. And it can be pulled pretty tightly. And we're going to go right up to her elbow as far as I can go, and then we'll come back down. And then I'll go up one more time. And that should be good. So that's about 3 layers of the cast padding. Next, I'm gonna get my stretch gauze. So this can be applied too tightly, so you don't wanna do it too tight, or else it'll cut off the circulation. So I'm just gonna pull it a little taut, but not too taut. And you don't want it to come in contact with the skin, so I'm going to leave a little bit of room where the cast padding was and just go right above that where I'm applying this. And the same thing, just half of You want to go over half of the area that you already did when you're going up. And we're just going to apply one layer of this. So you want it snug, but not too snug. Okay. And then if you have some left over, you can cut it. Get off my bandage scissors up there. Thank you. All right, so now those 2 layers are done. This is where I'm going to apply or put the stirrups over top. So what you're gonna do is undo it, you're gonna twist it, and then pull it up. So that'll help keep the bandage from slipping. And same thing on the other side. Just twist it at the base and pull it up. Okay, so now that those are on, we can apply our splint. So this splint is, every leg has a splint that'll go with that leg. So this is purposely for this front leg. So you want to make sure you can cut these areas if you need it any shorter. So for her elbow's in the right place. It's going to go up past where we're wrapping, and her toes are still going to be out of it. So this will be a good place. I am going to put a little piece of tape around the splint just to make sure that it doesn't slip off when I'm trying to put my stretch gauze around that. So I'll put it up to there where I want it. And then I'm just putting it around loosely just to hold it in place. But I don't make them touch, because if so it can cut off the circulation. I just kind of put it at an angle over here. And then I'll get my stretch gauze again and I'll put another layer of that over the splint. And again, not too tight with this one. You want it snug, but not too snug.
Aces in one.
All right, so now that that's as far as we can go, I'm going to cut that excess. And then my last layer will be applying vet wrap. So this does the same thing as a stretch gauze. You don't want to apply it too tightly because it can cause swelling in the toes. So I'm just gonna snugly put it on here, but not too much. I like to kind of unwrap it a little bit as I go. And then lastly, I have some elastic on, which I'm going to put kind of at the bottom over here to give them some traction when she's walking. So I just put it at the bottom of her paw pad, kind of, just to give her a little bit of traction. Okay, and then if you wanted to, you could also, I have some gauze. If you wanted to give some padding, you could always stick gauze or anything else in there just to pad the shoulder area a little bit. So after you do this, you're all done with the splint, and then you can take it off. So to take it off, all you're gonna do is you can either peel this elasticon off or cut it with the scissors. So I like to just move it, and then you just wanna be careful when you're cutting to make sure you're not actually cutting the patient themselves. So I'm just going up, I'm gonna cut the splint out of here. I got my splint off, and then I'll just cut the rest of it, off the rest of the layers. Can get pulled off. And any other tape that's on there. Why not? Alright, and that's how you place and remove a bandage. In this video, I'll be demonstrating how to do an emergency abdominal pressure bandage. So this will be placed just temporarily until either the patient goes to surgery or they just take it off. So I have all my materials here. What we're gonna do first is apply cast padding. So we're just focusing on pressure in the abdominal area. So I'm going to get my cast padding and just wrap it around the area. And you don't, for this, you don't have to worry about trying to keep their prepuce out of it or anything, because like this will just be a temporary bandage. So, and we can do this pretty snug. So now that we've done that, we are going to get our, so that was cast padding. We're then gonna get our stretch gauze out. And you just don't wanna touch the skin with the stretch gauze. So I'm gonna keep it on the, just above the cast padding. And I'm gonna put it snug, but not too snug that it's gonna cut off any breathing or circulation here. So this is snug. After I've done that,
She just paid, so they should.
I am then going to apply the vet wrap. Again, I'm not going to touch the skin with the vet wrap. I'm just going to put it right above the cast padding.
I think it was around 60 or 70.
Going around. I did loosen up the vet wrap just so it wasn't too tight when I was unrolling it. And I'm just going to make sure it's nice and snug. And after we've done that, the last thing I'm going to do is I have some elasticon. So I'm going to stick it on each side of the bandage to keep the bandage in place so that it doesn't scrunch together and move anywhere while the patient's moving. So I'll place that there, and then I'll also place one on the top as well. So I'm covering half of it with the bandage with it, and then half on the skin to keep that in place. That's how you place a pressure bandage that you can, it'll just be temporary and then you can take it off when needed.